A question becomes to us, what's better, a root canal or pulling it out? Here is the main reason why people make decisions. It's either going to be time, it's either going to be how much it's going to cost, or they're just afraid of the procedure. It's fear, time, and how much is it going to be. So if you've got a missing tooth, you really have four choices. You've got a bridge, you've got a partial denture, you've got a dental implant, and always you have. One of the things that is very typical on an everyday, day-to-day basis is people coming in with symptoms, and once we find out what the symptoms are, it seems to be somebody comes up, or one of the dentists will come up with like, oh, that's a cracked tooth. Right. So now, when you have a case that comes in, and what are the main symptoms when somebody comes in? They always say what? Like, I have a toothache. Okay, so when you have a panorex, you're looking at which tooth they're going to describe a tooth. They're going to say it's going to be the lower, upper, right, left. And in this case, they have symptoms on the lower left. And so when we go ahead and do this, we'll take either a panorex or a PA. And then we go ahead and take a photo of that tooth. Okay. So when we see a tooth, a patient is describing some pain. Dr. Pham was talking about a shooting pain. It's either, and I always ask, is it a dull? Is it a sharp? Is there a difference between a dull and a sharp pain? Yeah, there's a difference. A dull pain would be something where if somebody hit you in the arm, that's dull. A sharp pain would be something if somebody had a pin and they poked your finger, that's sharp. So we're trying to figure out what kind of pain this is. Is it dull? Is it sharp? When we have a tooth and it's not obvious which tooth, we've got to figure out which tooth it is. In this case, it's obvious because you could see the crack. But sometimes you'll see a photo, you barely see the crack. The crack is right here, right there, right? And so, compare that to this tooth where you could actually see the crack right there. Okay. So if you look at a tooth, sometimes it's not obvious. You can see the x-ray, and that's what we're looking at. So we're looking at a photo, we're looking at the tooth, we're looking at an x-ray, and when we're looking at these areas here, that looks like there's some bone loss. So if I was to compare that to a tooth, same tooth, just a few months before, could you see the difference? So this was 2 months before this, and in 2 months, you could see the destruction of bone right here. So you know it's not the last tooth, you know it's this tooth right here. And then with a photo, you could surely see it with a crack. See that crack? And then what happens is when we go ahead and pull the tooth out, you'll see this crack right there. And then when you separate the tooth looks like this. So that is a cracked tooth. So you've got a photo with a crack, and you take out the tooth, you can see the crack of the tooth. And then from the x-ray, you've lost a lot of bone right here. And outside that, you could also look at a photo clinically where it looks like this. So you've got x-ray, you've got photos, and then when we take out the tooth, you could see the crack. So now the question is, and this is the question that I usually get, what now? What can I do? What's my choices? The question is always, my tooth hurts. What can I do? You cannot save a tooth that's cracked. There's no way you could save this tooth. That tooth has to be pulled. The question becomes, what do I do after I pull it out? You've got a few choices. Bridge, implant, or denture. And then the other choice that you always have? Nothing. You don't have to replace this tooth. Everything that we do in dentistry is an option for you. The only thing that we have to make sure that we take care of are infection. That's necessary. It's necessary to fix the infection. But if we have to replace a tooth, there are those three choices that we say that we can do. We could go ahead and put a dental implant, put a bridge, and then a partial denture would be a good option for some people. But the fourth choice really could be leave that area blank. Now, what's the consequences of leaving that area where if you don't replace that tooth, what happens? You have to know the consequences of if you don't replace a tooth, what happens? And it's good to know what happens because that is something that some people really care about. Let's say, for instance, a person loses a tooth right here. The option would be, like I was saying, you could put a bridge that connects these two teeth. You could put a dental implant here. You could put a partial denture, but most people is not gonna wear a partial denture to replace one tooth in the back. Or you can leave a blank like this. And if you leave a blank like this, what's gonna happen? Sometimes teeth will drift. This will shift this way. This tooth will go down into that space, or it will stay just like that. And as a dentist, we know that is a good possibility that nothing will happen here because this tooth is touching this. These two teeth is in good occlusion that this tooth might not go this way, might not drift towards the front. So this tooth might stay pretty stable because this has an occlusion. They touch together here. This tooth touches here. This tooth touches the lower tooth. And so this situation might be a stable situation where if you do not miss a missing tooth, you don't have to replace that. And so the choices that you've got would be a dental implant, a fixed bridge that connects this tooth and has a artificial tooth right in between, a partial denture that's removable, or nothing. So that's basically the choices that you've got when you have a tooth that is extracted. Again, when a tooth cracks, you cannot save that tooth. That tooth's gonna have to be pulled. Sometimes if the tooth is cracked and it's savable, then you need to get a root canal. So if a question becomes to us, what's better, a root canal or pulling it out? There was a time in dentistry, not even long ago, that we were getting taught, go ahead and pull that tooth out because it's better to put a dental implant. After a few years, we're finding out that it's better to keep your own tooth, and we already knew that anyway, but we were thinking that if we replaced the tooth with a dental implant, that would be better than your natural tooth. Now, dentists, if you've been in dentistry long enough, you will see that the dental implants they don't work. They don't work all the time. So dentistry knows that if you keep your own tooth, it seems to last longer than a dental implant, given the same situation. If it's your own tooth, keep it. It's actually less expensive to keep your own tooth and just do a root canal and a crown in there. What do you think?
Yeah.
Now here is the main reason why people make decisions. It's either going to be time, it's either going to be how much it's going to cost, or they're just afraid of the procedure. It's fear, time, and how much is it going to be. So if you are wondering how much is a root canal, it's less expensive to do a root canal than a dental implant. If you could do a root canal and a crown, that would probably be less expensive than a bridge. That would probably be less expensive than a dental implant. So if you could do a root canal and save a tooth with a root canal, that is the best choice that you could make. But if you cannot save a tooth with a root canal, you're pulling that tooth out, and a good option to replace that tooth would be a dental implant or a bridge. Now here's another question that I usually get. I get this question about, well, what's the difference between a bridge and a dental implant? Yeah, but what's the pros and what's the disadvantage versus implant and a root canal? If you look at this situation where you've got a missing tooth and there has never been any filling or anything done with any particular tooth there, like this tooth, there's a filling here, but if you were looking at this situation, you would have to cut down this tooth and this back tooth to create a bridge. That would be I would say a good situation for some people, but if you don't have to touch this tooth or this tooth, a dental implant would be a better choice. If you've got two teeth that has not been prepared for any reason, a dental implant would be a good choice in that situation because you're not touching any other. It's independent of the two other teeth. So if you've got teeth that have been prepared, crowns, then it's already been prepared in crown. Then you can go ahead and create another bridge to be able to save that space. So a bridge is a good option. Not the best option if you've never touched the other two teeth. So if you got one tooth missing and somebody says you could put a partial denture, yes, less expensive, but most people will not wear that partial denture. It's just cumbersome. So if you've got a missing tooth, you really have four choices. You've got a bridge, you've got a partial denture, you've got a dental implant, and always you have a choice of doing nothing in that space. So you've got no treatment, and if it's a stable situation, you could go ahead and say, okay, I'm gonna leave it like that. If you never miss that tooth, don't do it. So if somebody is cracking teeth, that is something that's probably gonna happen to other teeth.